After surgery, we will round on the patients in the hospital, and we'll also have the home health and post-surgical aftercare service checking on the patients when they go home. Why do we do this? Why do we have our teams checking on the patients? Well, for obvious reasons. We are looking for possible post-surgical complications and recognizing those and getting them treated. I wanted to talk about, generally speaking, what complications we are looking for and how do those complications relate to what is normal after surgery. In the postoperative period, there are surgical related complications and there are medical complications. The main surgical related complications would be wound infection, a hematoma or a blood clot that's formed at the surgical site. So after surgery, there's been some ongoing bleeding and now there's a blood clot there. And spinal fluid leak, usually recognized during surgery, could be unrecognized during surgery and develop as spinal headaches after surgery. Those are the main post-surgical complications that we deal with. Hardware being misplaced is exceedingly rare because we check a CT scan before closing the wound, so we know exactly where the hardware is. It is normal for a patient to have some intermittent radiating pain in an arm or a leg that's similar to what they had before surgery, but not as bad and improving over time. It is not normal to have that same pain be worse after surgery, to have new numbness or weakness after surgery, and especially for the symptoms to be in both legs or in both arms. Those can be signs and symptoms of a blood clot or a fluid collection putting pressure on the nerves. So that's one thing that we look for. It is normal for the patients to feel pretty good on day 1 and worse on day 2, or doing pretty good for a couple of days and now on day 3 or 4 symptoms are worse. I think it's almost something that you should have a healthy respect for. I'm moving along, I'm progressing, but I'm on day 3, I'm on day 4, and boy, this back pain from the surgery is really, really catching up to me, and I'm having more symptoms now. That is completely normal. It is normal to have pain be worse in the 3 to 5 day period after surgery than it was at 1 or 2 days, and then we usually see that pain typically resolve over the ensuing several days past the 3 to 5 day mark. I think that there's some inflammatory markers, and also patients are being more active as they're recovering from surgery that almost feels a little bit like a setback, so that is normal. Again, it is not normal to have worsening leg pain, and especially if it's associated with new weakness, and so we want to pay attention to that. The other complications we are looking for are non-surgical complications, but are more medical. And the main ones there would be urinary tract infection, pneumonia, and deep venous thrombosis and pulmonary embolism. We've talked a little bit about deep venous thrombosis and pulmonary embolism, but basically swelling in one leg and shortness of breath would be 2 very important signs to pick up on. Urinary tract infection can be associated with burning and frequency of urination. Pneumonia can also be associated with fever and shortness of breath. These are medical complications that can occur and should be recognized early in their course and treated promptly. One final thing that we run into with some frequency is post-surgical rashes. And it's relatively common actually to have a rash for one reason or another. Maybe the patient's irritated by the prep solution, by the surgical dressing. There is an ioban surface layer that's put on the skin during surgery to help prevent infection. Maybe some medications that were given in the perioperative period. I don't always know what the rashes are from. If you've broken out in a rash after surgery, don't be alarmed, but do let us know so that we can make sure that we get you the most appropriate attention and care.